Most people know asthma. Many have heard of COPD. But there is a respiratory disease that quietly destroys lungs while remaining almost invisible to the public, and even to many healthcare professionals. It is called pulmonary alveolar proteinosis. This disease does not start with wheezing or dramatic attacks. It starts silently, inside the smallest structures of the lung, the alveoli. The alveoli are microscopic air sacs where oxygen enters the blood. In pulmonary alveolar proteinosis, these air sacs slowly fill with a thick, protein-rich material, almost like wet cement. The lungs are not inflamed. They are not infected. They are simply clogged. Imagine trying to breathe through a sponge soaked in glue. Patients often begin with vague symptoms, shortness of breath on exertion, fatigue, a dry cough. Because the symptoms are mild at first, the disease is often misdiagnosed as asthma, pneumonia, or heart failure, and time is lost. As the material accumulates, oxygen cannot pass efficiently into the bloodstream. Blood oxygen levels drop. Patients feel air hungry, even at rest. Simple activities, walking, showering, talking, become exhausting. What makes this disease especially misunderstood is its cause. In many cases, pulmonary alveolar proteinosis is autoimmune. The body produces antibodies that block a critical signal needed for lung macrophages, the cleaning cells of the lung, to do their job. Without this signal, the lungs lose their ability to clear surfactant, a substance essential for keeping alveoli open. So the lung drowns, not in water, but in its own biology. Diagnosis is challenging. Chest imaging often shows a characteristic pattern, but it can mimic infections or pulmonary edema. Pulmonary function tests reveal restriction and reduced oxygen diffusion. Definitive diagnosis may require bronchoscopy, where milky fluid is washed from the lungs, a moment that often surprises even experienced clinicians. Treatment is equally unique. There is no simple inhaler, no quick pill. The gold standard treatment is whole lung lavage, a procedure where one lung is ventilated while the other is repeatedly filled and drained with warm saline, literally washing out the disease. It is one of the most dramatic treatments in respiratory medicine. In selected cases, targeted therapies that restore immune signaling can be used, but access and awareness remain limited. Why does this disease remain ignored? Because it is rare, because it does not fit common diagnostic boxes, because it requires specialized respiratory teams to recognize and treat it. But for patients living with it, pulmonary alveolar proteinosis is not rare. It is daily breathlessness, daily fatigue, daily fear. This disease reminds us of an essential truth in respiratory medicine. Not all shortness of breath is asthma. Not all lung disease is caused by smoking or infection. Sometimes the lungs fail because the body forgets how to clean them. And awareness is the first step toward giving these patients their breath back.